Good morning. I'm Frank Marco. I'm a partner in the law firm of Gregorio and Marco. I also serve as general counsel to the International Association of Ironworkers, as well as to the Impact Fund. I've been working with Taft-Hartley Health and Welfare Funds for over the past 20 years, and my partner, Greg Jose, will also be making this presentation with me. Greg?
Thank you, Frank. I'm Greg Jose, also at Gregorio and Marco here in Chicago. And I've been representing Taft-Hartley Welfare Funds for about the last 12 years, and specifically the Riggers Local 136 here in Chicago in the Ironworkers universe.
The reason why we're talking today about the essentials of healthcare clinics is we're trying to figure out a way to deliver better healthcare and also to bend the cost curve so that it's more favorable to our industry. The cost of medical care has been skyrocketing for my entire lifetime. And definitely since I've been representing Taft-Hartley plans. When I first started representing them, no one wanted to mandate any cost-cutting controls because times were good, the costs were not out of control, and so there were no mandates. After that, every plan that I've worked with at least started implementing mandates in order to save costs, whether it's mandatory generics, mandatory medical cost management review, or some sort of utilization controls in order to get a handle on the rising, skyrocketing costs. These costs have been well exceeding the cost of inflation, and they've also been something that's wreaked havoc with our health plans, where a lot of the raises that are going mainly to the health plan rather to the guys' wages, and also our country in general. We pay more in the United States for healthcare than any other country in the world, and we find that we're not really delivering better results. So one of the solutions that is being bandied about today are healthcare clinics. The idea of getting better healthcare results at a better price by improving primary care. Our health model has generally been fixated upon treating illnesses and paying our professionals, our doctors, our hospitals according to illnesses that they treat or exams that they undertake or tests that they perform, rather than just paying the individuals in the healthcare clinics or the hospitals based on keeping people well or solving one of the problems that might be facing the guy in terms of his health care. So that is why we're talking about the essentials of healthcare clinics today, is a way to start bending this cost curve in order to get better results at a better price. That's something that everybody's always looking for, but particularly in the field of healthcare nowadays. So the next slide that I have is deals with why develop health clinics to begin with. And as I mentioned, the very number one is just keeping participants healthy. We as fiduciaries that sit on healthcare boards, if we can keep our participants healthier than they were yesterday, we've done our job, we've fulfilled our fiduciary duties. Don't just treat the illnesses, but through better primary care, help keep that individual as well as his family healthy and happy. And the way to do that under these healthcare clinics is to attract more participants through better service. Make it convenient for them. A lot of people complain that if they set up a physical with their doctor, they get an appointment a month out, 2 months out. And we all know individuals that have experienced medical problems that can't get in to see a doctor within a short period of time. And you never know when that long period of time is just a little bit too long, depending on the healthcare needs of that individuals. So we try to make it easy, really easy, in order to get that medical appointment. This saves money by avoiding unnecessary emergency room visits, and it primarily increases the percentage of people who see a doctor. Our studies have found that the number of people who don't have a primary doctor, the number of construction workers in particular who don't have a primary doctor that they see on a regular basis, is upwards of 50%. Half the people just don't see a doctor. Not all of them are young 22-year-old guys. Many of them are middle-aged people that are starting to have some health worries, but they just don't like to go through the hassle in order to get bad news. And so they avoid it. Further information is that about half of those individuals, their whole family isn't regularly seeing a primary physician. So this is something that if we want to bend the cost curve and save any money in the healthcare field, we got to get to the early detection of potential diseases. An individual who goes see a doctor every year The doctor is able to take his vital signs at that point, take his blood, and whenever anything changes from year to year, they can gradually track it and stop a disease in its tracks through early treatment, diet, exercise, small doses of medication, whatever it might take in order to keep that person healthy for a longer period of time is what they're trying to do. We also find that a lot of prescription drugs are not handled properly. About 50% of the people who are either given a script, they either don't fill that script, or they don't take it in accordance with the instructions. Either one of those two situations is a potential disaster. So if someone's in regular communication with their doctor concerning their prescription drugs, it's a lot better than leaving them on their own, to let them know that they have to take one pill a day and one pill every other day, because they just don't do it. Or at least they just don't do it on a wide basis. Some people do it perfectly, half the people don't. And that's the half that we're trying to fix here. The first thing that I just want to bring everyone's attention is the ownership options. How are you going to build these clinics? Most plans that are out there have, let's say, less than 1,000 participants, and they don't have the wherewithal to start building all these clinics that they're going to need in order to serve their membership base on their own. Even a large fund that might have 3,000 to 4,000 members, that large fund would not be able to set up a clinic in each different location that they're going to need to serve the vast majority of their membership. They might have enough to fill 2 different suburbs or 2 different counties that in their area the members tend to live, but they're not going to be able to reach as many people as you want to. You want to be able to serve a majority of your participants, hopefully even a vast majority of your participants. If you're only catering to one group that lives in one county, the other participants are going to resent it and wonder why they're paying extra in order to only serve health clinics in a given segment. Now, some people live far out. You're not going to have a clinic when there's only 5 people that live in a town. But the more you partner up with other funds, other like-minded funds, people that you know that also have a fund about your size, that also can't do it on their own, if you get 3 or 4 of those funds together, then your ability to start building clinics that meets the needs of all your membership is drastically increasing. If you could afford to have 2 clinics on your own, you could probably get 5 clinics if you partner with just 3 other funds of your size. Cost is always a factor. Spread the risk and increase participation by partnering with other funds. If you can't do that, and you got to do it on your own, and you're a large enough fund where you're going to do it, you're going to find that you're going to be missing some segments of your population, and at some point you're not going to want to do that. So at least explore that possibility. Rivalries shouldn't matter. Whether the other trade is a rival of yours or they do your work in the field isn't a primary concern. Greg and I, when we go to a doctor, we don't care who that doctor saw right before we got in or right after. It could be a management lawyer for all we know. They don't tell us, and it doesn't really matter. The key is to kind of keep your costs down and allow the majority of your members to have access to these type of clinics. And Greg, you worked with one of our funds, and we're kind of developing that there's a couple different options that you can have in terms of clinic models. If you could go into that a little bit for us.
Yeah, thank you, Frank. Another one of our clients, the plumbers here in Chicago, have their own wellness center, and they have seen great outcomes and a lot of great participation from their membership and their participants. And they've taken the closed approach. This is where the fund itself owns and controls the single wellness center. Of course, they're paying for all the overhead and they're taking all the risk. But at the same time, they get to control all of the services and all of the service levels that go along with the wellness center. And that's been very important to them. We're no longer looking at sort of a cattle call type of medicine. We're looking to take care of the whole person, spending 30 to 45 minutes with the participant to get a holistic view of their lifestyle and the needs that they have moving forward, to try to take care of any symptoms that they might have, any conditions they might have, and prevent additional conditions from coming up in the future. Now, this also gives them the ability to expand if they want to, and they have 17 counties here in the Northern Illinois area that they would like to see covered. And that's where some of the partnering options that Frank talked about earlier have come in. Another approach is a more open approach, and we've seen different providers make this an option. For example, Marathon is partnering with Ulico and offering an opportunity to get involved in a network where the construction costs would not be borne by the welfare fund or welfare funds, but they still have the opportunity to take part in all of the different wellness center locations that might end up being built throughout the area. And this is attractive because it's lower cost. You don't have the sunk cost of the construction, but you'd still have the access to maybe not just one, maybe 3, 4, or 5 locations. And the downside to this is that you could end up with less responsiveness because you have more funds involved, and Marathon and Ulico would be operating the centers with regard to all of the potential funds that are involved. You don't have the same level of responsiveness. You can't necessarily pick up a phone and demand one change as a result of something that you've seen with one of your participants and expect that it gets done, because the contract isn't simply with you, it's with a large number of funds.
You mentioned your experience with the plumbers, and you've been spearheading their efforts to develop clinics in the Chicago region. And I believe that we started with a closed approach and also with just the plumbers building it on their own. And then as the need arose and they wanted to expand more, that's when the kind of a coalition coalesced around those notions.
Absolutely. And we've stayed with the closed approach, but we have expanded to a number of different funds in the area, including Local 63 and Local 136, that are involved in bringing more and more participants together. And these locals are going through the process now of hiring a vendor to run their closed network, and are looking at as many as 5 locations to start out here in the Chicago area. And we've done a nice job of bringing everybody together and working together as really a consensus model to make decisions on the services that'll be offered and try to keep everybody healthier in the construction trades moving forward.
So now it looks like you're going to be able to have 5 locations throughout the Chicago metropolitan area. And prior to opening it up to other trade unions and their funds, how many did we think that the plumbers alone could have?
They could have supported maybe 1 other location, possibly 2, depending on the size. But their participant level was strong enough to support maybe 2. That would have been enough to put probably 40% of their participants within a 30 to 40 minute drive of a location. Going together with these other funds, including 63 and 136, with 5 different locations, they're going to see almost 70% of their participants within a 30-minute drive of one of the locations.
And that's why even if you're a large fund and you're able to put up some of these clinics, you're better partnering with other like-minded funds in order to increase the participation and the reach to all of your membership and all of your participants, or at least as many as 70%.
Fiduciary duty, as we all know, is all about process. You have to be able to document that you engaged experts and that you relied upon them in making the determination to open a healthcare clinic or multiple clinics, partner with other funds, whatever decision you might be making with regard to your fund. The first step in this particular case is engaging a healthcare consultant. You want someone who has a healthcare background and who has set up clinics in the past. This gives you an opportunity to lean on them as you are working to engage a healthcare clinic manager who's actually going to do the day-to-day operating. They will go about the process of hiring the nurses, hiring the medical assistants, and handling all of the day-to-day purchasing and all of the medical care that goes on. They'll also work with you very closely to hire the actual doctor that'll be working in your facility. The hiring process for the doctor is key. You want to make sure that you have someone that fits in well with your population. And if you don't get the right doctor, it can really submarine the success of the healthcare clinic long term. Once you've got those pieces in place, you want to decide on the size and the location of the clinics. Now, of course, you want to get as much utilization as possible, which means you need to locate them as close to your population as possible. You think about where fast food restaurants are; they're not, we're in sparsely populated areas. They're where the people are. Because you need to make it convenient. We're trying to get people who either don't see the doctor as regularly as they should, or folks that do, and try to capture cost savings along the way. And if we don't have them in the clinic, we never will be able to do that. You need to negotiate a lease, of course, for whatever space that you're going to take over. I would strongly recommend that you actually do lease a space as opposed to build it yourself. That's going to lead to lower costs long term. And you don't have to worry about all of the potential delays that come in with construction there. If you do need to build out your location, of course, you have to go through the competitive bid process for your general contractor. Of course, all of you will be very familiar with that sort of process.
For utilization being the key and selecting these locations, how far of a reach are your members willing to go in order to go to a clinic? What is your information in that regard?
So we've set a target of a 30-minute drive. We're trying to get it closer to 20 once the new centers come online, and potentially even more after we get this first round of a network up and running. But right now, 30 minutes is our target drive time. Now that works for us in terms of the Chicago metro area and what we expect traffic to look like and things of that nature. But the closer you put it to people, the better. So when we're picking the 30-minute drive time, we're trying to put it in a location where there's a very high concentration of trades members. And we've looked at all of the demographic data to pick 5 locations that make the most sense for the entire population.
And the healthcare consultant, they work with you on that. They take all the funds, addresses for all their participants and create what they call as a heat map that puts a little dot in every single spot that a participant is.
Exactly. We've gotten all of the demographic data from each of the funds that are involved and plotted them on the map of the Chicagoland area and selected the locations that made the most sense. So other legal considerations, if you are going the route of a coalition, you need to map out how exactly you're going to share costs. Initially, as you're getting the clinics up and running, it's probably going to be best to do that on a per capita basis. That's what we're doing here in Chicago, and then transitioning it to a utilization model. One of the keys for the Department of Labor will be to make sure that eventually the funds are paying for what they're getting and not anything more. And that will take an audit process, and you can lean on your professionals for that. But it is important that you get to a place where utilization drives the cost. Of course, you're going to need plan amendments and potentially a trust amendment if your trust document does not provide for the establishment of clinics of this nature. We've also run into some concerns with regard to what's referred to as a MIWA, or a multiple employer welfare arrangement. The Taft-Hartley funds that we all represent do not fall into that category under ERISA because they're collectively bargained. So the way we've gotten around some of these concerns that have to do with whether or not we're going to see state law regulation on the coalition, what we want to do is hardwire that into the collective bargaining agreement. So if you have an addendum to the collective bargaining agreement that from the bargaining parties that lays out the authority of the trust fund to create the coalition and then create the clinics that the coalition will operate, that should take care of any of your concerns. And finally, you want to determine what the plan amendments are that you're going to need and how you might charge your participants. Thus far, we've made the determination among the coalition that the plans will offer all of these services deductible free and copay free. The idea being if it's free, the participants are more likely to take advantage of it. But of course, that's a determination best left to your board of trustees.
And Greg, just discussing a little bit more on the legal agreement governing coalition costs and controls. If one fund has 5,000 participants and another has 500 and another has 2,000, how do you fairly distribute the cost? And also, if you're going to have 5 different clinics in a given region, but one of the locals, let's say all their population is really kind of dedicated in one of these counties, not spread out evenly like the larger ones may be. Um, how have you developed a cost sharing method that everybody believes to be fair?
So our initial cost share method is based entirely on the number of participants that you have in your fund. Right now, we have 5 funds that are involved in our coalition, and each fund well, we have one fund that's approximately 50% of the population, and the others in other smaller proportions. And we have determined to share costs, sort of the administrative costs, on a per capita basis. So that's your legal costs, any auditing costs to begin with, and the cost of our healthcare consultant. After that, once we have the locations up and running, for the first 2 years, we will bill each fund for the operation of those locations, as well as any of the construction costs, the lease costs, and any other administrative costs that come along with it, on that per capita basis, while we determine how many people from each fund are going to end up going to each one of the locations. Once we have that utilization data, which our auditor will come in and determine what the proportions are for each specific location. And at that point, we'll transition after about 2 years into a utilization model, so that each one of the locations will be billed differently to the funds based on how many of their participants actually use that particular clinic location. So you might see local 63, for example, be very high in one location and very low in another location. And we think that's the most fair way to administer the coalition long term.
And then how does democracy work in a coalition like this? Would each fund have one vote if you have 5 funds that are part of this coalition? Or does it get weighted according to the number of participants or the number of money expended by each different fund?
The way we've designed it so far is to have everybody have one vote. So there's one management and one labor representative from each of the 5 funds, and everyone has an equal say. It's been very important from the coalition members from the very beginning that we all be treated as equals. We saw another set of funds try to go down this road, and some of the larger locals were not willing to give up that sort of power, that sort of equality. And it really harmed their chances of making this work. So we think the equal say and equal vote is very important long term to making this a successful venture.
It sounds like one of the most important parts is the clinic manager. That's really the one who's getting involved with selecting the doctors, the nurses, the receptionist staff. How do you go through selecting the clinic manager?
Well, the first thing you have to do is run a competitive bid process. There are several providers out there nationwide, such as Cerner, who operates the Plumbers 130 clinic here outside of Chicago. There's also Marathon, whom I mentioned earlier, that's partnered up with Ulico. And then Premise is another strong national company that we'll be hearing from in our RFP process. There are other more regional players as well, and they're going to vary depending on where exactly in the country you are. But there are many different companies out there to hear from. Once you've run that process and you get comfortable with who it is that's going to be running your operation, you have to, of course, make sure that you are protecting your participants. You need to make sure that they have strong HIPAA compliance measures. You have to keep the contract in a reasonable term. Of course, ERISA requires that. We are recommending you keep it in the 3 to 5 year window. You need to determine whether the ownership of the clinic is going to be yours. Each one of these companies is going to, of course, have an interest in keeping it as close to the vest as possible, and trying to make sure that you don't steal their employees down the road if you decide to move to a different vendor. Hopefully that won't be the case. But you'll have to deal with those non-compete and anti-solicitation clauses if we do end up in that situation. You'll want to work very closely with the clinic manager to ensure that all the expenses are taken care of. You want to understand exactly how all of the prescriptions that might be offered for free at the clinic will be handled. All of the different furniture, who's going to bear that expense? Is that part of the lease? taking care of all of the staff and any turnover that might take place there as well. One of the things that you also have to consider is, do you have just one location, or do you envision having additional locations in the future? I'm sure the clinic operator will be very interested in working with you to open up additional locations in the future, and that exclusivity to that provider will give them a great incentive to continue working with you and work very closely. You also want to make sure that you have all the required insurance, and I would push a lot of this, and as much of it as possible, onto the clinic provider themselves. You want to make sure that you have property insurance against any liability there, cyber liability insurance, malpractice insurance, which will, of course, be the responsibility of the doctor and any medical practice that you contract with, workers' compensation insurance, and officers and directors' liability insurance. These are all a very key part of making sure that we're compliant with our fiduciary obligations.
So everyone in the clinic, all the employees, that they will be working for this clinic manager and not for the individual Taft-Hartley fund. Is that correct?
That's right. That's I think the best way to make sure that you're limiting the risk on the fund and making sure that your clinic operator is a true partner. At the same time, you want to have input into who you're selecting, especially with regard to the doctor. In Illinois, the doctor cannot work directly for the clinic operator, in this case, Cerner. But you want to check state law on how professional corporations can interact and physicians can interact with larger corporations.
What type of services are generally offered, or what type do you think are efficiently offered by healthcare clinics?
So the primary service is going to be primary care. This is sort of your general doctor that you think of when you go to get your annual physical. If you come down with the flu or a sinus infection, that sort of thing, this is the doctor that you would call. And that's where you really want folks to adopt your wellness center, your healthcare clinic, because that's where you can capture the savings, especially with people who typically do not go to the doctor and have a primary care physician selected. Of course, you're going to have a nurse along with that. Physical therapy is a piece that we've found to be very important. Having a place that the members can go to rehab from various injuries. And of course, in the construction trades, you're going to see a lot of shoulders and elbows, knees, hips that are going to need some care along the way. And having a place that belongs to them has been very important. And that's a service that we've seen utilized greatly. We've also seen a pretty high demand for optometry. And there have actually been a couple of cases where folks have had a piece of metal fly into their eye, things of that nature. And we've had great quick care, and we've seen folks have their sight saved as a result of the care provided at this particular wellness center. You also want to work with the clinic provider with regard to pharmaceuticals. There are a certain number of generic drugs that they can provide at no cost or very low cost that will make things much easier for your participant and hopefully avoid some of the trend of not filling prescriptions that Frank mentioned earlier.
Part of this is the convenience in order to attract people. So if somebody wants to get an appointment with their doctor, what's the expected wait time or lag time before they can actually get in?
Well, there's usually not much of a time at all. If it takes more than a day or two, that's often very surprising. And once we get a participant in the door, the wait time is less than 4 minutes on average at the Plumbers Welfare Wellness Center. And that's the level of service that we're expecting coalition-wide as we continue to build out in the Chicagoland area. It is very important that we treat participants and their time is very important so that we provide great service and get them coming back, and that word of mouth continues to travel throughout the participant universe to bring more folks into the wellness centers.
And in the world of iron workers, an individual could be working straight for 3 months and then get laid off on a Tuesday. So he would be able to get in that week if he calls in for an appointment on a Wednesday, typically.
Absolutely.
Okay. And then, so if he's trying to get an appointment and his appointment's in 3 weeks, but he's got another job starting, that becomes more difficult for that individual. They tend to just blow off the appointment rather than blow off the job. They need the money to support their families, and they can always postpone their health care to some later date. And that's what we're trying to avoid by getting everybody to get in there when it's convenient for them, without any cost to them. So they don't have to worry about how much money they got in the bank, or if they were laid off, they're not going to have to put some out of pocket into the doctor's office. So they could go in there, get checked out. How about prescription drugs? Would the doctor be able to prescribe some prescription drugs and have it filled at that clinic?
That's certainly what we're looking for as part of our coalition. We have a certain number of them at the Plumbers Clinic, and the ironworkers locals that have been involved in the coalition have been very interested in that. So we want to make sure that that's part of all of the different centers that we're opening, and try to expand it as much as possible. We're trying to limit it just enough to make sure that it doesn't trigger any concern with regard to our pharmacy benefit managers. Thus far, they have not had an issue with the number of prescriptions that are available, which is about 50 to 55. And we're trying to expand that as much as we can.
All right. And then are there any ideas about expanding some of these services in clinics?
We've actually had some of our coalition partners talk about dental. And we think there might be a place for that, but our motto thus far has been, let's walk before we run. So we're sticking with primary care services, physical therapy, and optometry, and of course the limited pharmacy benefit. But we have considered dental, and if there's enough demand out there for another service, the coalition is definitely open to that.
Perhaps the most important, or equally important, is the cost curve. So we talked earlier about this. The goal of this is to not only get better results, but kind of either shrink the increase in medical care or even decrease it at some point. If you can go through some of these examples of how we're trying to bend the cost curve through the use of these clinics.
The keys on bending the cost curve are really a couple of things that Frank talked about earlier. Avoiding unnecessary emergency room visits. The more you can keep your participants out of the ER, obviously, the better off your fund is, both from a monetary perspective and from a healthcare perspective. The ER is really going to stabilize somebody and then send them back out the door. And that's not the approach that we're looking for here. If we can detect illnesses early on, detect chronic conditions early on, maybe prevent someone from developing diabetes or a heart condition or high cholesterol, all the better. We can save money long term by spending just a little bit up front. Eliminating the profit motive is a big one, and this really goes hand in hand with providing better service. This is all about keeping your participants healthier, keeping your workforce healthier. If they have fewer injuries and fewer illnesses, they're going to be on the job and getting their job done, and they're going to be much happier while they're doing it. You don't have to worry as much about the insurance overhead. You're paying for the clinic and all of its staff, whether you've got 5 appointments or 25 appointments filled in a day. So let's get the 25 appointments. And again, the biggest key is capturing those participants who don't have a primary care physician. If we can get them in the door and detect early on any illnesses or injuries, that's where you can really capture the savings long term and see medical inflation for your fund drop.
The fiduciary duty of plan trustees is to administer these plans for the exclusive benefit of the participants, and that includes defraying reasonable costs. Whenever you're approaching a topic such as this, where you're trying to change the way that you're delivering medical care, take your time, be deliberate, do RFPs whenever you're hiring a professional, because you want to know what's out there, and you don't necessarily know what's out there. And your trade partners that you're familiar with, they also might not have been in this spot either. So do your RFPs, meet with them, consult with them, and document your decisions everywhere along the way, because these decisions are important, and they're also going to be lasting, particularly if you have a coalition. Each person is going to remember different things differently. So document the decisions that you made and why you made it. Establishing a health clinic is a way to provide these benefits, minimize costs. But take the time, get the right information so that you can make the right decision as a trustee, and then hopefully we can all get the right results at the end of the day. So I thank you for your time, and Greg, thank you. That's it for us.